Hi, I'm Shanna, a first-year family medicine resident here in Calgary, was previously a medical student at UBC, and today I'm answering a viewer question. Shout out to Angela for sending in a question just wanting to know about my journey applying to family medicine residency, what I did to get in. Her first question was what kind of exposure or things that led me to be interested in family medicine. So UBC is really good, and I think a lot of programs like this too. So throughout first and second year, I believe it was about once a week or so, we would do an experience with a family medicine doctor, work in their clinic for half a day and get exposed to family medicine that way from the ground up. I specifically chose the option which you can do your family medicine experience totally in another language. So I chose to do mine mostly in Chinese. So I did Cantonese and Mandarin. I would say I'm pretty decent at Cantonese, not so much at Mandarin, but those are just like, and for me it was really important to me, and I'm so glad I chose that experience because I'm very passionate about, regardless of what doctor I was going to become, I was sure that I really wanted to make sure I was serving my community. So I'm Chinese myself, that I would be serving my community and my people who face a lot of language barriers in the healthcare system at times. It's a very frightening experience, and I knew that was going to be part of my practice. So I was really excited to work in there and experience, and it was nice to both work on my medicine and my Chinese at the same time. So I did my experiences. I did two experiences in Vancouver. One was a family medicine doctor who did a lot of GP obstetrics, meaning she delivered babies, a lot of prenatal visits. Another one that was more of a plain family medicine clinic. That was really nice because I was in my community. And I did I think two or three more experiences, maybe it's just two experiences in second year that were based in Richmond. And so one was an all women practice, a bunch of different female GPs, and I really liked that one because I love the energy in that room, and they and just showing how that they had that work-life balance and how they love the job and the feel of running your own practice. And another one was a older gentleman. So at UBC, our third year, our clerkship year rotation, it's mandatory for us to do a rural family medicine rotation. I ranked and luckily got my first choice of Main Island, which is a small island off of so big Vancouver. So if there's Vancouver, there's big Vancouver Island, and there's small islands like Salt Spring Island, Galiano, and Main Island is one of them. It's less known than say Salt Spring, and which is nice. It is actually very rural, in that you and the physician that you work with is the only physician in the entire town, and the only other thing is there's ambulance, but in that you are the emerge doc, you are the doc seeing all the seniors, you are just everything. And we don't even have a pharmacy on site, and labs only comes once a week, and so there's a lot of things that you really have to think carefully if you do anything, because you're really managing everything at your level. Then electives that I did in fourth year, two rural family medicine electives. I did one in Qualicum Beach, which is on the island, I believe north of Nanaimo. And then I did another one up north in BC, which was Canal. Originally wanting to do one out in the interior, but I ended up replacing that one with another Chinese speaking elective in Richmond. And I'm really glad I did that one again, because it really it's the patient population that I'm very passionate about. When did I decide on my specialty? I decided that I would rank family in CARMS at around the end of my third year. I think starting around February, that's when I started changing electives and things to make sure it has some family. And then yeah, I think that's how it goes. And I think right now I'm working with some friends about choosing electives and things, and I remember that being it felt like it had to be there was an absolute answer. I really think there is no absolute answer. I ended up doing only 2-week electives at a time for family medicine, but I like that length myself. I personally didn't feel like I got a ton out of doing longer electives. Other electives that I thought were complementary to applying to family medicine. So family medicine is different, and not every specialty is like that, but they encourage you beyond the family medicine experiences. Just a couple for you to get enough reference letters to apply to family medicine is to get a broad experience in your elective year of things that are related or helpful. So I did a month of emergency medicine up at Lionsgate Hospital, which I really loved as a program. Really nice people and great emerge docs, and a lot of them are family doctors who end up doing some extra emergency training. So really nice people. I would encourage that. I wouldn't say it wouldn't really necessarily set you up for really strong letters, because you don't work with many people many times, though I did get one of my reference letters from there. Just happened to be lucky with that. I also did a neurology 2-week elective, which I found was really hard, and I was with a bunch of people who were going for neurology, so I felt like I stood out like a bit like a sore thumb. But I think that is really useful because a lot of these conditions get chronically followed up by us later. I thought ENT was actually quite useful. You see a lot of ears and throats and noses in family medicine, so definitely another useful one. I ended up doing a community plastics one, so not the plastics elective you would do if you were actually going for plastic surgery. I went out to a far community site. I believe I was working out in like Port, Moody, and Surrey, and so those are working with GPs who ended up being a surgical assist, which is like a family medicine role. So I really liked that and enjoyed that, and it was really low stakes for me. Both the ENT and plastics were what we call post CARMS, so they don't really count for, they're too late for you to get like a CARMS letter, so it was very low stakes, and I thought it was just good learning. I have some friends who were interested in doing GP obstetrics, and so did some OB or GPOB. I think things that could be, now that I'm here, I would say are very complementary to family medicine. I would say internal medicine can always be helpful, particularly if you can do it at a smaller community site as opposed to like a big hospital. Like that's where all the internal medicine gunners will go. But if you go to a smaller one, where if you think, you might see yourself as being a GP that does, family doctor that does hospitalist, or just in general knowing how to manage chronic conditions, you could also think about doing some psychiatry. Though specifically, if there's an experience that gets you outpatient psychiatry, I think that's more useful than inpatient psychiatry as a family doctor. Really, there's a lot of stuff that could be useful, like sports medicine, probably even some orthos, probably not a bad idea. Honestly, I don't really think there's anything particular you have to do, but I would make sure you get at least, a couple weeks of family medicine in there. I guess, the year that we had no out-of-province electives because COVID basically shut everything down, and we have a very different CARMS than if you guys watching video next year or the year after. Things will be different for you guys. So if you were really strongly considering like Calgary, and like it would be nice to come work here for a couple weeks and just get a sense of the people, and if you think you'll really like and click and enjoy living here for 2 years. So the next question was which programs that I applied to. I only applied to 4 programs, which is retrospectively a really small number, but I felt like it was sufficient. I applied to the Calgary, where I am now. I applied to UBC, which is my home school. I applied to Ottawa, and I applied to Western. So a question about what was my rationale behind program ranking. It was really hard to make that program ranking decision. I have it now, and it's a bit funny now that I'm looking at it. I'm not sure I would actually rank it the exact same way. So at the top of my list, bunch of UBC urban programs. Then I had Calgary. Then I had a little bit more smaller communities for UBC programs. Then I had Ottawa. Then I had more rural sites. Then I had Western. But interestingly, I actually personally, at the time, I was really conflicted because I really liked the Western program. I thought they were nice, the interview, they had a lot of things that I wanted. It's just that it was very far from home for me. So, but retrospectively, I think I would have been open to ranking it higher now that I found that moving away has been a lot easier than I thought, and I don't really feel like a need to go home often or that I am homesick at all. So anyways, so I would definitely be changing this order up, but I guess to go in more detail. So for example, I ranked North Vancouver at the top, so the coastal program, just because I really love my Lionsgate experience and I wanted to work in like a smaller program. So I ranked coastal, I ranked Vancouver Fraser, at Surrey, St. Paul's, the Indigenous program, Chilliwack, Abbotsford, Nanaimo, and then Calgary. So Calgary, I would say, UBC is very interesting because it's like there's so many sites, it's a very different thing. So Calgary was actually really high on my list. And I think I wrote, interestingly at the time I wrote because it's near Banff, it seems like a very nice place to live. I remember watching tons of YouTube videos on like what life in Calgary was like. And there was a what's called a +1 program for Calgary that I was quite interested in. So at the time I was interested in maybe doing an EM +1, so they had a good number of spots. And so that was why Calgary was so high on my rank list. And then I have the other programs like Victoria and Kelowna and Okanagan. And then I really like the Ottawa program. It was like very academic. And they have stuff like Kamloops and Prince George. So anyways, I could go down to this in more detail. It's kind of a longer list. Yeah, Kelowna, and then Western London, Western Windsor, Strathcona. So honestly, if I would go back in time though, I would change this list a bit. I think I would definitely put Western London much higher. It has a block-based curriculum, lots of teaching, lots of elective time. So I really would have put that up there if I wasn't so fearful about moving away. Ottawa was still something that really appealed to me. They had such a good, fun resident vibe. I actually would have ranked some of the more like semi-rural or rural programs a lot higher. For example, like I really like the idea of Prince George, UBC. So it has lots of electives. They have a strong ICU experience, like strong emerge experience. There's supposed to be a really great crew of people up there. The LULAC program, I think even higher than programs. I don't think I actually would have ranked the urban Vancouver programs as much, actually. I find that working in a big city has some downsides. As I am now, I'm actually working in a clinic that's in like the heart of downtown of Calgary, and that means you don't see as many like acute things, you don't manage them, you do a lot more bread and butter family, which is fine, but I think I would like to have a little bit more like procedural time and see a little bit more like acute or sick patients. So those are some things I would have changed up a little bit. Or for example, I think the Okanagan South is a really good program. It has extensive exposure to procedures and deliveries and for surgical assist, and it's supposed to be very one-on-one teaching experience, etc. So I would really think about whether or not you like autonomy or you like being really like handheld in your teaching experience. So perhaps I might not have chosen the particular clinic that I've chosen right now in Calgary, which is like kind of famous for more like hand-holding, etc. I realize I personally like enjoy more autonomy. So there are some clinics in more peripheral sites of Calgary that give you a lot more autonomy. So I would have thought that through a little bit more, but it's one of those things you don't really know until it's actually happened. So yeah, I'm not an expert on residency or family medicine residency, but I hope this has helped you a little bit. CARMS was a really stressful journey in a way because it felt like you were really locking your whole life down. And you're just arbitrarily to this algorithm that puts you all over the place. I think it is good to apply to like rank as many programs as you think you'd be possibly interested in. Rank more than less. I actually didn't leave any programs off list, so like I ranked all of UBC's like a bajillion different programs, like sites that I like wasn't super sure I would want to go to, but I put it there anyways. I just felt like it gave me a sense of security, safety to know that there's like lots and lots of options on there. So what I like about the Calgary program right now is that we don't do callbacks during the week. Like I really don't like that, except we do academic half day. So we do academic half day for family medicine specifically once a week. But when I'm on other programs besides that, I don't go back to family medicine clinic, and that's a big change in prior years, and a lot of places will still do that. I personally, so I guess the downside of that is it's supposed to interrupt your learning in terms of like longitudinal care with your patients. Personally, I haven't found that to be a downside yet. I like that when I'm on my rotation, say I'm on my internal medicine or my emergent elective, I'm just there and I don't have to like think about like switching back and forth between the different mindsets or schedules. So for example, in year one, I'll be doing family medicine with behavioral medicine and mental health, addictions, family medicine with addictions, family medicine with child, family medicine core, family medicine community, longitudinal, and I'm doing longitudinal long-term care. I'll do adult emerge, I'll do electives, I'll do internal medicine, I'll do obstetrics, I'll do pediatrics, and I'll do psych emerge. We do a presentation, a scholarly presentation, as well as do a QI project. Then in second year, we do 4 more blocks of family medicine. Then we do a care of the elderly block, 2 electives, which can include ICU or cardiac care. There's hospitalist, low risk maternity, musculoskeletal, pediatric emerge, palliative care, and rural family medicine for 2 blocks. So yeah, that is the Calgary Family Medicine program. So anyways, leave me questions in the comments. Are you interested? Who are you and what are you watching? Are you a pre-med interested in family medicine? Are you a medical student interested in family medicine? Are you junior? Are you first and second year? Are you third and fourth year? Already decided? And just give me some context if you have any questions about that. And yeah, so I would overall say if you're pre-med watching now, just realize that it doesn't end there. Once you get into medical school, then you go through another whole process, like basically the medical school process again to get into residency, and then it just kind of goes on from there. So anyways, hope you hit that subscribe button, like this video, and I'll see you in the next one. Bye!